Hello, I'm Dr. James Bogash with Lifecare Chiropractic in Mesa, Arizona. Been in practice 21 years, and today we're going to talk briefly about why regenerative procedures in our office are different from all of the other offices that are starting to add in things like stem cells and PRP. We've been in practice for 21 years now, and we generally do very well with most conditions. I've had patients with arthritic knees that within 6 visits they have very little pain left. We obviously didn't fix the arthritis, but the arthritis wasn't the only pain generator. And having our understanding of soft tissue work using Graston, NMR, ART, stretching, we're able to get those tissues healthy and functional again so that they don't hurt. But we haven't changed the underlying arthritis that is present in the joint. Nothing can do that short of a surgical procedure. However, regenerative procedures like PRP and stem cells are the next step closer to getting that joint even healthier. That is why, just like everything else, these regenerative procedures are not a panacea. They are never designed to be used alone. They should be used in conjunction with something else that's designed to get that knee or any other particular joint back to its optimal health. It is one of the reasons why I feel that we have a unique and better product than most of the people that are out there. It's one of the things that we continue to promote, and one of the reasons why I feel we get better outcomes for the same amount of money.